we simulate the treatment of a flare-up of a chronic epicondylitis, so we are interested in an effect on the pathological substrate and on the symptoms reported by the patient. As regards to the treatment of the pathology, we use an anti-edema effect to promote the removal of the exudate in the interior of the tendon sheath. As it regards instead the underlying chronic tendinopathy, we aim to a biostimulant effect. About the patient's symptoms, contrariwise, we will have an analgesic effect and we will have a relaxing effect on the whole musculature of the dorsal side of the forearm. In this case, we choose an already set program on the QMD, so we choose district mode, elbow. In this case, QMD makes us choose the type of tissue to be treated, the tendon and bursa. The type of pathology, acute inflammatory in this case, the depth of the treatment area, and in this case, superficial. The treatment area in this case on average 5 cm per 10 cm. The phototype of the patient in this case, we choose the clear skin, and the age in this case, the age group between 18 and 50. Based on this data, the device calculates the power and the energy to be administered for each phase of treatment. Through the button on the right, it is possible to access to the menu for each phase of treatment, in which is encoded the type of treatment and the duration for each phase. Also on the right, there are visible some advices about the different treatment areas of the interested district. For the first phase of treatment, we select a program in the pulsed mode with fixed frequency. We have already applied the small spacer. We will have to perform a slow movement along the treatment area that goes from the third proximal of the forearm to the third distal of the arm. For the second phase of treatment, we choose a biostimulating program in continuous mode. The treatment area will be limited to the insertional and pre-insertional areas of the tendons of the extensors of the carpus and of the fingers. The spacer is still the small one. The third phase of treatment has a pure antalgic target. We still use the small spacer. The mode is the superpulsed. The treatment point is that with the greatest pain indicated by the patient. For the fourth phase of treatment, we use the harmonic pulsation. We use the medium spacer. The treatment area is at the level of the myotendinous junction. The pointer must be kept fixed.